in OBG. First question. A 30-year-old G2P1 woman presents with a 28-week pregnancy and painless, bright red vaginal bleeding. Fetal heart rate is reassuring. What is the most likely diagnosis? Options are A. Cervical ectropion, B. Placenta previa, C. Vasa previa, D. Placental abruption. So, what is the hint? Consider the condition where the placenta's location can cause painless bleeding in late pregnancy. The answer may be placenta previa. Yes, that's right. Placenta previa is the classic cause of painless, bright red vaginal bleeding in the second half of pregnancy due to the placenta's position over or near the cervical os. Next question. Which of the following is the most common cause of postpartum hemorrhage? Options are A. Coagulopathy, B. Retained placental tissue, C. Genital tract trauma, D. Uterine atony. The hint is think about the most frequent reason the uterus fails to stop bleeding after the childbirth. The answer may be uterine atony. That's right. Uterine atony or the failure of the uterus to contract and retract after delivery is the single most common cause of postpartum hemorrhage. Next question. Question number 3. A 45-year-old woman presents with heavy and prolonged menstrual bleeding. Pelvic ultrasound reveals multiple uterine fibroids. What is the most common type of fibroid responsible for causing this symptom? The options are A. Pedunculated fibroid, B. Subserosal fibroid, C. Intramural fibroid, D. Submucosal fibroid. The hint is consider the fibroid location that would most directly affect the uterine lining. The answer may be D. Submucosal fibroid. That's right. Submucosal fibroids grow into the uterine cavity and they are most common cause of heavy menstrual bleeding due to their proximity to the endometrium which they disrupt. Next question. Option number 4. Question number 4. Which of the following is considered a probable sign of pregnancy? Options are A. Breast tenderness, B. Fetal heart tones heard by a Doppler, C. Positive pregnancy test, HCG, D. Amenorrhea. So what's the hint? The sign is a strong indicator of the pregnancy but can be affected by certain medical conditions. The answer may be C. Option C. Positive pregnancy test, that is HCG. That's it. Positive human chorionic gonadotropin HCG is a probable sign of pregnancy as it indicates the presence of a hormone specifically produced during the pregnancy, although it can be falsely positive in rare conditions. Next question. Question number 5. A 25-year-old woman is diagnosed with PCOS. Which of the following is a classic triad of symptoms associated with PCOS? Options A. Amenorrhea, hirsutism, and hypogonadism. Options B. Oligomenorrhea, hirsutism, and obesity. Option C. Menorrhagia, acne, and weight loss. Option D. Dysmenorrhea, alopecia, and hyperthyroidism. The answer is oligomenorrhea, hirsutism, and obesity. That's right. A classic triad of PCOS is oligomenorrhea or amenorrhea, hirsutism due to hyperandrogenism and obesity, though not all patients have all the three. Next question. Question number 6. What is the primary function of human chorionic gonadotropin in early pregnancy? Options are A. It stimulates uterine contractions, B. It promotes lactation, C. It causes uterine growth, D. It maintains the corpus luteum. The hint is think about the hormone that prevents the corpus luteum from degenerating, which is necessary to maintain the pregnancy. The option D, which maintains the corpus luteum, that's the right answer. HCG is crucial for maintaining the corpus luteum, which in turn continues to produce progesterone and estrogen to support the early pregnancy until the placenta can take over. Next question. Question number 7. A 28-year-old woman has been trying to conceive for 18 months. Her menstrual cycles are regular. Hysterosalpingogram shows blocked fallopian tubes, which is the most likely cause of blocked tubes. Options are A. PCOS, B. Uterine fibroid, C. Endometriosis, D. PID. The most common cause of blocked fallopian tube may be option D. PID. That's right. PID usually caused by STIs like chlamydia or gonorrhea is the most common cause of tubal factor infertility due to the extensive scarring of it can cause in the fallopian tubes. Next question. Question number 8. What is the first line treatment for an ectopic pregnancy in a stable patient who meets specific criteria? Options are A. Expectant management, B. Salpingostomy, C. Laparoscopic salpingectomy, D. Methotrexate. The hint is this medication is used to stop cell division and is an alternative to surgery for certain patients. The answer is methotrexate. Methotrexate is a chemotherapeutic agent, is the first line medical treatment for a stable patient with an ectopic pregnancy as it stops the growth of the rapidly dividing cells of the pregnancy. Next question. Question number 9. A 22-year-old woman is diagnosed with an ovarian cyst. The cyst is small, unilateral, and anechoic on ultrasound. She is asymptomatic. What is the most appropriate management? She is asymptomatic. What is the most appropriate management? Options are A. Observation and repeat ultrasound in 6 to 8 weeks. B. Start combination oral contraceptives. C. Immediate surgical removal. D. Laparoscopy to drain the cyst. The hint is consider natural history of most small simple ovarian cyst. The answer may be observation and repeat ultrasound in 6 to 8 weeks. That's right. For a simple asymptomatic ovarian cyst, the most appropriate management is to observe it, as the majority of these cysts are functional and will resolve spontaneously within a few menstrual cycles. Next question. Question number 10. What is the active phase of labor and what is its typical cervical dilation range? The answers are transition phase 8 to 10 cm, active phase bit 4 to 10 cm, C latent phase 0 to 6 cm, D active phase 0 to 4 cm. The answer is active phase 4 to 10 cm. The active phase of the labor is traditionally defined as cervical dilation from 4 to 10 cm, during which the rate of dilation accelerates. Next question. Question number 11. A 32-year-old prima gravida at 34 weeks of gestation presents with a blood pressure of 155 by 105 mmHg and 3 plus proteinuria on urine analysis. She complains of severe headache and visual disturbances. What is the most appropriate next step in the management? Options are A. Start antihypertensive therapy and admit for observation. B. Order a serum glucose test to rule out gestational diabetes. C. Administer magnesium sulfate and prepare for delivery. D. Perform a cesarean section immediately. What is the answer? The answer in this case may be focus on the most immediate life-saving intervention for the mother given in the severe features. Administer magnesium sulfate and prepare for delivery. That's right. Severe features of preeclampsia indicate a high risk of eclampsia seizures. Administering magnesium sulfate is the most critical first step to prevent seizures, followed by planning for delivery, which is the ultimate cure. So, dear students, you may be advised to comment. Please comment in the comment section what is the answer for each and every question whenever you go through. Next question. Which of the following is the most effective form of emergency contraception? Option A, copper. Option A, copper interuterine device, IUD. Ulipristal acetate, UPA. Levonorgestrel, Plan B. Option D, combined OCPs, YZUP regimen. So the answer is IUD, copper IUD. Copper IUD is the most effective form of emergency contraception. It can be inserted up to 5 days after unprotected intercourse and offers long-term contraception. Next question. A patient is undergoing a routine pap smear. The primary goal of this screening test is to detect option A, cervical cancer and its precursors, B, ovarian cancer, C, endometrial cancer, D, PID. Remember, the pap smear is a tool for cervical screening. In this case, the answer is cervical cancer and its precursors. That's right. A pap smear is a cytological test designed to detect abnormal cervical cells, which are precursors to cervical cancer, allowing for early intervention. Next question. Question number 14. Which of the following hormones is responsible for thickening of the endometrium in the proliferative phase of the menstrual cycle? Options A, progesterone, B, LH, C, FSH, D, estrogen. The hint is this hormone is produced by the developing follicles in the ovary and is dominant in the first half of the menstrual cycle. The answer is estrogen. That's right. Estrogen secreted by the developing ovarian follicles is the primary hormone that promotes the proliferation and thickening of the endometrial lining in the proliferative phase. Then what about secretory phase? That is progesterone. So next question, 15. The definitive diagnosis of an ovarian tumor is made by clinical examination, ultrasound imaging, histopathological examination, serum CA 2125 levels. The answer in this case is histopathological examination. See, that's only definitive way to diagnose an ovarian tumor and determine if it is benign or malignant is through histopathological examination of the tissue. Next question. The primary role of prostaglandins in labor is to options A, increase blood pressure in the mother, B, inhibit uterine contractions, C, promote cervical lipening and uterine contractility, D, cause fetal lung maturation. The hint is think about the role of these substances in preparing the cervix and the uterus for delivery. The option C, promote cervical ripening and uterine contractility. That's right. Prostaglandins play a dual role in initiating the labor by causing cervical ripening, softening and effacement, and by stimulating the contractility of the myometrium. Next question. Question number 17. A patient with suspected gestational diabetes mellitus (GDM) should be screened with a glucose tolerance test at which gestational age? A GTT test at which gestational age? Options are 24 to 28 weeks, B 10 to 14 weeks, C 36 to 40 weeks, D early first trimester. The hint is the physiological insulin resistance of the pregnancy becomes most pronounced during the second trimester. In this case, the answer is 24 to 28 weeks. That's right. Routine screening for gestational diabetes with a GTT is performed between 24 to 28 weeks. Next question. Which of the following is a classic finding on ultrasound for a complete hydatidform mole? A. So snowstorm appearance. B. Intrauterine gestational sac with a yolk sac. C. Normal appearing placenta and fetus. D. Small gestational sac with no fetal pole. Hint is this appearance is created by swollen cystic chronic villi in the uterus. The answer is snowstorm appearance. It's a characteristic ultrasound finding for complete mole is the snowstorm or grape-like appearance, which represents the swollen chronic villi. Next question, 19. A 60-year-old postmenopausal woman with a history of hypertension presents with vaginal bleeding. What is the most likely diagnosis that must be ruled out first? Options are A. Endometrial hyperplasia, B. Atrophic vaginitis, C. Cervical polyp, D. Endometrial cancer. The hint is the most serious and common cancer that presents with postmenopausal bleeding must be ruled out first. That is endometrial cancer. That's right. Any postmenopausal bleeding must be considered cancer until it is proven otherwise. Endometrial cancer is the most common gynecological cancer that is a primary consideration in this scenario. Next question is 20th. Question number 20. Which of the following describes the correct timing of the administration of anti-Rh in a Rh negative pregnant woman without antibodies? Which of the following describes the correct timing of the administration of anti-Rh in Rh negative pregnant woman? Options are A. First prenatal visit only. B. Only within 72 hours of delivery of Rh positive baby. C. During the second trimester, 28 weeks within 72 hours of delivery of an Rh negative baby. D. Immediately after delivery, regardless of the baby's Rh status. In this case, the hint is this is a two-part prophylactic strategy to prevent isoimmunization. So the answer may be during second trimester, that is 28 weeks, and within 72 hours of the delivery of an Rh positive baby. Next question. Which of the following hormones is primarily responsible for maintaining the secretory phase of the menstrual cycle and preparing the endometrium for implantation? Options are A. LH, B. FSH, C. Estrogen, D. Progesterone. We have already seen. In this case, the answer is D. Progesterone. That's the progesterone is secreted by corpus luteum. It is the key hormone that transforms the endometrium into secretory and receptive state. It prepares for the pregnancy. Next question. Question number 22. Which of the following is a classic finding on ultrasound for a partial hydatidform mole? Options are A. Normal placenta with a fetus that has high heart rate. B. A Swiss cheese appearance with coexisting fetal parts. C. A large abdominal mass separate from the uterus. D. A snowstorm appearance without the fetus. The hint is think about the key difference between a complete and a partial mole in terms of fetal presence and placental appearance. In this case, the answer may be B. Swiss cheese appearance with coexisting fetal parts. Next question. 23. A 35-year-old woman presents with secondary amenorrhea, galactorrhea, and visual field defects. The most likely diagnosis is a pituitary tumor producing is options ACTH, B. Growth hormone, C. TSH, D. Prolactin. So the hint is the symptoms of amenorrhea, galactorrhea directly relate to this specific pituitary hormone. The answer is prolactin. Prolactin, it is a prolactinoma that is the most common type of pituitary tumor and is classically associated with hyperprolactinemia leading to galactorrhea and secondary amenorrhea. Large tumors can cause visual field defects due to compression of the optic chiasm. Next question. Question number 24. Which of the following is considered a long-acting reversal contraceptive? LARC. Options are A. Combined OC pills, B. Contraceptive patch, D. DMPA injection, D. Male condom. The answer are the first. Let us see the hint. This method offers pregnancy protection for several months or years without daily action from the user. The answer is DMPA injection, that is right, depot medroxyprogesterone acetate. It is a progesterone injection given every 3 months, which is a form of LARC. Next question 25. A fetal heart rate tracing shows a late deceleration. This is most often associated with which of the following? Options are A. Umbilical cord compression, B. Uteroplacental insufficiency, C. Fetal arrhythmia, D. Head compression. The hint is the timing of the deceleration after the contraction is a key clue to the underlying cause. In this case, the answer is uteroplacental insufficiency. Late decelerations are caused by uteroplacental insufficiency, which leads to a transient decrease in fetal oxygenation after the peak of a uterine contraction. Next question. Question number 26. A woman presents at 20 weeks of gestation with a history of cervical incompetence. She has had 3 previous second trimester miscarriages. What is the most likely intervention indicated? Options are A. Induction of labor, B. Cervical circulation, C. IUD insertion, D. Progesterone supplementation. So what is the hint? This intervention is a surgical procedure to provide physical support to the cervix. The answer is cervical circulation. That's right. Cervical circulation is a surgical procedure to place a stitch around the cervix to keep it closed and is the primary intervention for cervical incompetence to prevent late miscarriage or preterm birth. Next question. Question number 27. What is the most common symptoms of endometrial cancer? Options are A. Postmenopausal vaginal bleeding, B. Severe pelvic pain, C. Abnormal vaginal discharge, D. Unexplained weight loss. The hint is think about the warning sign that prompts most women to seek medical attention. The answer is postmenopausal vaginal bleeding. Abnormal uterine bleeding, particularly postmenopausal bleeding, is the most common presenting symptom of endometrial cancer, allowing for early detection in most cases. Next question is 28. A patient is admitted in labor. Fetal head is presenting, but it is in a deflexed position. Which of the following presentations is this? Answer is options A. Bridge presentation, B. Pro presentation, C. Face presentation, D. Occipito anterior. Hint is this is a challenging presentation that can lead to arrested labor and is a type of malpresentation. The answer is bro presentation. That's right. A bro presentation is a partially deflexed position with the fetal head presenting between flexion and hyperextension and is often in an arrest of labor. Next question. Question number 29. Which of the following is the most common cause of female infertility? Options are A. Uterine factors, B. Endometriosis, C. Ovulatory dysfunction, D. Tubal factor. The hint is think about the most frequent reason a woman not release an egg which each month. The answer is ovulatory dysfunction. That's right. Ovulatory dysfunction, such as that seen in a PCOS, is the most common cause of female infertility. Next question. 30th one. The definitive treatment for choriocarcinoma is options are A. Chemotherapy, B. Immunotherapy, C. Radiotherapy, D. Hysterectomy. The hint is this type of cancer is unique because it responds exceptionally well to medication rather than surgery. The answer is A. Chemotherapy. That's right. Choriocarcinoma is highly chemosensitive tumor. Chemotherapy, either single agent or multi-agent, is the definitive treatment. Thank you. Please like, share, and subscribe.